Bismillah ar-Rahman ar-Rahim. Our lecture is neck mass. Anatomical landmarks of the neck. The neck extends from the lower border of the mandible to the upper border of the sternum. The main landmarks or important landmarks are hyoid bone, being followed by thyroid cartilage, cricoid cartilage, trachea, suprasternal notch, and the sternum. All these in the midline. On the lateral landmarks are sternocleidomastoid muscles. The neck can be divided into main triangles, anterior and posterior. The anterior triangle bounded upward by inferior border of the mandible and laterally by the anterior rim of the sternocleidomastoid muscle, and medial or middle line, imaginary line, past the middle of the neck. Posterior triangle bounded anteriorly by the posterior rim of the sternocleidomastoid and posteriorly by the anterior rim of the trapezius muscle. Below is upper surface of the clavicle. Anterior triangle can be subdivided into 4 groups or 4 triangles. This subdivision done by anterior and posterior biliodigastric muscle and upper part of omohyoid muscle. Submandibular triangle between the 2 belly of digastric muscle and the inferior border of the mandible. Submental triangle between anterior belly of digastric muscles and apex in the genome of the mandible, and floor of the triangle is hyoid bone. Vascular or carotid triangle between posterior belly of digastric muscle anteriorly by omohyoid muscle and posterior by the sternocleidomastoid muscle. This is this triangle, important triangle because of presence of the main blood vessels and nerves pass in this triangle. And the muscular triangle, which contains as well as to the muscle and important organ, which is the larynx and trachea. The posterior triangle also subdivided by passing of the posterior part of the omohyoid into occipital and subclavicular triangle. Lymphatic distribution. Lymph nodes distributed in the head and neck, and submental, submandibular, and parotid, and pre-auricular, post-auricular, occipital. Most of these are superficial cervical lymph nodes. Also, anterior chain groups, cervical groups arranged in chains anterior to the sternocleidomastoid, called anterior cervical chain, deep or internal jugular vein group or chain, and posterior superficial cervical group and posterior cervical group along the spinal nerve of the accessory nerve, and the supraclavicular lymph nodes. And there is anterior group of lymph nodes in the paratracheal or laryngeal group. Some books divide the lymphatic lymph nodes distributed in the neck according to the levels, level 1 to level 6. Level 1 including submental and submandibular group. Level 2 include upper deep cervical group, the upper part of the sternocleidomastoid. Level 3, the middle part of the sternocleidomastoid. Level 4, deep cervical lymph nodes in the inferior part of the sternocleidomastoid. 5 is posterior triangle, group and 6 in the paratracheal and paralaryngeal group. Now, the etiology of the neck mass. Neck masses can be divided in main three groups: inflammatory, congenital, and neoplastic. And the incidence of each differ from one to other according to the age group. Pediatrics or children and young adults have more chance of congenital and inflammatory causes of neck masses, while the neoplastic is more in adult group more than 40. Differential diagnosis of the neck mass. The neck masses can be divided into middle and or lateral group. Some books divide it according to the pathology into congenital, inflammatory, and neoplastic. I will depend on the distribution according to the anatomical site. So, the middle neck groups face congenital, like thyroglossosis or dermolysis, lymphadenopathy, either inflammatory or neoplastic, neoplasm, either benign and or malignant, or inflammatory like thyroiditis, infected thyroglossosis. احنا نعرف التشو الموجود بالنيك هو سكين وفات وفايبرس تشو كارتليج، فنتوقع ان اي تايب اوف تيومر حسب التشو المعروف عندنا. من نعرف الانتم راح نعرف الديزيز المتوقع في هذا المكان. Lateral neck masses also can be divided into congenital like lymphangioma, hemangioma, lateral thyroglossosis, developmental like branchial cyst, pharyngeal pouch, and laryngocele. Swelling related to the gland itself, submandibular gland, thyroid gland, and parotid gland, the tail of parotid gland, including in the neck, in the parapharyngeal space of the neck. Differ from congenital and developmental, as you know. The congenital at birth, developmental develop later on during life. Parapharyngeal tumors, including parotid tail and carotid body tumor, also in the lateral group. Then congenital, inflammatory, neoplastic. Fourth اللي هو parapharyngeal tumor in the parapharyngeal space, and soft tissue swelling, usually in the midline and extend on the lateral, sometimes start from the lateral and extend to other side. Cervical lymphadenitis, either acute, especially in the upper respiratory tract infection, or chronic, like in syphilis, tuberculosis, AIDS, and etc. Calcium clutch. Cervical lymph node tumor of the lymph node itself, like lymphoma or metastasis to the lymph nodes. Sternocleidomastoid muscle tumor and cervical rib can be put in the diagnosis of the lateral neck mass. Now, how to manage patients with neck mass? Whether anterior, posterior, lateral, middle. Okay, we start with history, clinical examination, investigation, and biopsy and treatment. First, history. We have to take a time with history, because each point in history means way of diagnosis. Age, personal data including age of the patient was important, as I mentioned. Some type of the tumors or congenital or inflammatory according to the age. The inflammatory and congenital more in the small age group, and neoplastic in the more than 40 group. Sex or gender difference from some tumors more in male and other more in female. Give a clue. Nationality also sometimes of tumors common in some age and racial differences or racial distribution differ from race to race. Some tumors more common in the fast east of Asia and some in the middle. African disease differs from Asia. History of present illness. We have to ask about the onset of the mass. How long it's acute or chronic. Size of the mass in the middle of the neck or in the lateral. Size of the mass is important. Whether it is small, the presented size from start of the illness, or it is gradually increased, or it is small and then increased rapidly. It is important, and each one means something else. Slowly growing or rapid progressive. يعني نصير rapid progressive يفكر بالmalignant tumor أكثر. Slowly growing يمكن يكون benign tumor. يمكن يكون developmental. العمر اللي صار به هذا يمكن congenital ما في شيء، بعدين صار مثل عمر 4-5 سنوات بدأ يبين نقول developmental like brain cyst or pharyngeal pouch and so on and etc. How it's not either accidentally or not by the patient itself, like thyroid enlargement, more common in female because more of the female spend time for cosmetics in front of mirrors, so it's more early notice the enlargement of the gland, and or accidentally by radiological examination or something else. Painful or painless? Painful more go with inflammatory rather than tumor. Painless mass, we have to put in mind the tumor, either benign or malignant or congenital. Other mass. Other masses present with that mass. As, for example, when we found swelling in the angle of the mandible, I think of parotid tumor, there is cervical mass. So this may be the original tumor in the parotid, and this is the lymph nodes. Tumor or mass within the larynx, and there is a cervical lymphadenopathy or cervical metastasis. So we have to know the other masses and connect with the original one to reach the diagnosis. Progression of the mass, whether it is regress or progress in size. After treatment, if the patient said that they have the mass, but after taking or receiving a medicine, it will regress. So go with the inflammatory rather than tumor. Trauma also, sometimes trauma and swelling due to trauma, hematoma, and Systemic review. Any symptoms and signs of hypo or hyperthyroidism. That are for symptoms of hypo or hyperthyroidism, tachycardia, or sleeping, or hoarseness, or increase in body weight, and according to the condition of the thyroid hormones. Symptoms which indicate malignancy, like weight loss, cachexia, emaciation, anemia, and so on, according to the type of malignancy and according to the site. Respiratory symptoms. Respiratory symptoms: cough is important, hemoptysis is important. يمكن تخليني تروح باتجاه التيوبركلوسيس، يمكن تخليني تروح باتجاه التيومر، لأن أكو أحيان تصير سيرفايكال ليمفادينوباثي هي أصلا من البانكوست تيومر من سوبراكلافيكولار ليمف نود، تبين عندي بالدوم مالت اللنج، ويمكن تكون metastasis to the lung. Any tumor in the neck, metastasis to the lung. So it's important. And GIT symptoms, gastrointestinal symptoms, also important in the diagnosis, because some form of the tumor, like gastric tumor, may present with some left side cervical cervical lymph node at the supraclavicular region or subclavian region. Symptoms which indicate infection or inflammatory, like fever, weight loss, night sweating, weight loss, rigors, whether it is acute inflammatory or chronic inflammatory. Each of them is important in the diagnosis. Head and neck symptoms. Other head and neck symptoms may be either disease in the neck and the head, مثلا tumor of the nasopharynx, present with 70% present with cervical lymph nodes. Tumor in the sinuses, tumor in the mandible, present with cervical lymph nodes, and salivary gland tumor, and so on. Compression symptoms. يعني نوع من التيومرز يمكن لو كانت بد tumor compress the veins and arteries. main artery will cause the body tumor and carotid artery, creating engorgement in vein, and any tumor compressed on the blood vessels of the neck. Can I see these symptoms, either form of engorgement in the neck, or back pressure on the lung and heart to rehabilitate this neck. And feature rise suspicion of malignancy. فين يخلينا نفكر بالمالجنسي، وهذا أهم شيء. هو المريض يخاف من عند المالجنسي، يقول له أي شيء ترى المالجنسي هو be satisfied and be reassured. First, if there is hoarseness and change in voice, I think of tumor of the lungs. Odynophagia and dysphagia, think of tumor in the GI tract, upper GI tract in the pharynx. Hemoptysis, think either metastasis to the neck, to the lung, or original tumor in the lung and present with cervical lymphadenopathy. Previous radiation, history of previous radiation, especially for thyroid tumor indicator of malignancy. نقول إن المريض أنا مسوي radiation أنا أفكر بالمالجنس ما أفكر بالبناين tumor. oral lesion recent trauma gloma sensation يحس المريض إنه أكو فد شي ببلعومه، يقول أنا من أبلع ريقي أحس أكو فد شي مثل الماس واقفة ما جاي تنبلع ما جاي فهذا أيضا أفكر بال post cricoid tumor especially in female. دول يكون عندهم iron deficiency anemia إضافة إلى هذا sensation with loss of crepitus of the larynx. Referred pain, referred ear pain or referred otology and decrease in hearing. Sometimes symptoms of patient with sore throat, patients with odynophagia and referred otology. After examination, we see the after examining the patient, we saw tumor in the larynx, supraglottic tumor with referred pathology. Another constitutional symptoms is important: anorexia, weight loss, indication of increased suspicion of malignancy. Unilateral discharge or unilateral nasal discharge or epistaxis. Unilateral epistaxis, severe epistaxis with discharge, pain and other symptoms in the nose ممكن تنطيني hints إنه أكو malignant tumor in the sinuses or nasal cavity. Nasopharyngeal carcinoma can present with epistaxis and nasal discharge and obstruction. Family history of cancer also increase suspicion of. So, بالexamination عندي lump in the neck. مصطلح اللي سهل عن الاكزامينيشن حتى لا ننسى، يقول 5 physical examination for lump in the neck. Base 5 students and 3 teachers go for campfire. 5 students and 5S: sight, size, shape, surface, and scar. 5 teachers, 3 teachers or 3T. 3T: tenderness, translumination, and temperature. All of them is important in the examination. Go for campfire. Consistency of the mass, attachment to under surface or to the skin, mobility, whether it is lateral mobility or up and down, pulsation. Some tumors, especially carotid body tumor, press on the carotid so it is pulsar, and fluctuation, especially in the abscess. Irreducibility، نضغط عليه ما يروح، هذا hard tumor. And regional lymph nodes and age of the tumor, whether it is diffuse or sharp edge, matted or single. All of these important in the examination of the lymph node. بالنهاية بالإنسبكشن هسه نشوف البالبيشن of the mass. شو راح نفحص بالبالبيشن؟ temperature مالته، size, tender or not, surface, smooth, regular, irregular, age, regular age or irregular age, multiple or single, consistency hard, fluctuant, pulsatile, firm, relation to the skin, fixation to the skin, fixed to underlying structure, mobility, lateral, medial or up and down, and relation to underlying structure. تعرفون temperature معناتها هو infection ولا tenderness معناتها inflammatory أكثر. size مالتها يفيدنا حتى for follow up. surface مالته أيضا smooth اتجاه البنان. irregular تزيد chance of risk of malignancy. الage شفنا sharp edge أو uniform edge تروح ويا الانفلاماتوري أكثر من ما هو من التيومر. fluctuation باتجاه الابسس أو cystic. pulsation حسب المكان إذا هو pulsatile معناته أكو vascular disease. and relation to the skin fixation معناتها هاي قد يكون lymph nodes fixed معناتها advanced stage of malignancy. mobility إن أكو نوع من التيومر والكاروديبال تيومر can be moved from medial and lateral but cannot pass up and down. هذا يعتبر واحدة من الدايجنوستيك فيتشر مالته. percussion on the sternum for retrosternal extension of the thyroid. شوف هل اكو extension خاصة بالثايموس tumor. and auscultation of the neck to exclude thyrotoxicosis يصير عندها بروي during examination of the neck vessels. اكو نقاط تهمنا بالفحص. نشوف بالcongenital masses generally يكون soft smooth and mobile. يمتى تصير تندر؟ إذا كانت infection من الثايروغلوسال cyst. Inflammatory is tender and mobile in acute, while chronic masses or chronic lymphadenopathy or lymphoma are often non-tender and rubbery, may be either mobile or feel like matted together. matted adenopathy فكر بالليمفوما. In elderly age group, submandibular and parotid gland become ptotic and mimic neck lumps and can be cause concern to patients. أحيانا تخدع هاي الباروتيد تسمى كونبارزي لأنه soft tissue بالإلدرلي يضعف فيتراون إنه أكو تيومر بس هو مو تيومر. هذا normal things. هذا الجدول يبين إن بين السوتي symptom move with the swallowing. شوف الثايروغلوسال yes move with the swallowing. goiter move with لأنه related to the larynx and this is related to the hyoid. السايت مهم البين شوفه بالليمفادينوباثي موجود. برينكيال سيست إذا infected. goiter إذا أكو thyroiditis. dermal إذا infected. وثايروغلوسال cyst also لكن إذا كان أكو infection. moving on protrusion of the tongue شوف هو pathognomonic for thyroglosal cyst. Physical examination. Don't forget examination of the head and neck. Look to it for any mass or ulcer in the head قبل لا ننزل النك. has a relation. يمكن يكون هذا النك cervical lymphadenopathy due to primary tumor in the head. هاي الطريقة الجاي نبينها. الاكزامينر يوقف خلف المريض يفحص الليمف نودز. This is the submental lymph node and this is the submandibular lymph node. Thyroid examination from behind. Ear examination is important. Also nose to exclude nasal tumor or post-nasal tumor. Ear is important. Some tumor of the nasopharynx causing otitis media with effusion. and to exclude inflammatory disease of the ear present with cervical lymphadenopathy, especially in the angle of the mandible, in the upper deep cervical lymph node, due to ear disease rather than neck disease. Throat examination also important. Examination of the throat to exclude primary tumor or inflammatory disease like tonsillitis or pharyngitis may be present with cervical lymphadenopathy. Mouth examination to exclude any gingivitis, ulcer, tonsillitis, tongue problems may present with cervical lymphadenopathy, either inflammatory or neoplastic or metastasis. Laryngoscopy examination, either direct or indirect. This is a picture of larynx to exclude any tumor of the larynx or hypopharynx or cricopharyngeal or postcricoid tumor present in the posterior area of the cricoid cartilage. The laryngoscope also important to include upper cervical part of the esophagus tumor. This examination of the paratracheal lymph nodes and thyroid cartilage, thyroid gland. Investigation. Laboratory investigation including complete blood picture, ESR, blood film to exclude any blood disease like lymphoma, leukemia, sometimes present with cervical lymph nodes, tuberculosis, ISR, throat swab for culture and sensitivity, Klebsiella lablar bacillus for to exclude diphtheria. Tuberculosis test is important also to exclude tuberculosis, whether it is primary or secondary tuberculous lesion in the neck. Serologically, sometimes atypical mycobacterium cause cervical tuberculosis. And serological tests to exclude syphilis, AIDS, and cytomegalovirus, infectious mononucleosis, and Epstein-Barr virus. And radiological examination, the important examination is radiology. Chest X-ray to exclude metastasis or primary tumor like Mancos tumor or colon ball picture of the metastasis tumor to the lung. Ultrasound important to differentiate whether it is cystic or solid. CT scan is a very important radiological examination. Is CT scan and MRI, MRA, or MRV, PET scan based on emission tomography. It's an important quality of radiological test. Thyroid function test and fine needle aspiration is a cornerstone of any mass in the neck. We have to send the patient for fine needle cytology, acid fast bacilli culture, aerobic and anaerobic, and lastly excisional biopsy. نشوف بالسوفت تشو الام ار اي اكثر فائده من السي تي سكان in the soft tissue pathology. Fine needle aspiration, any mass is not an obvious abscess. شفناها مو abscess، يعني احنا حتى الابسس احيانا اذا ما شفنا انه اكو redness ودسك كلر وفلكتوينت وجانتين دارنس، يعني هيستوري تمشي ويا الابسس، نفكر لازم ندزها فور فاين نيدل اسبيريشن. اني ماس اذا استمرت اكثر من 2 weeks كورس اوف انتيبايوتكس نحتاج الى نسوي لهم فاين نيدل اسبيريشن. تشوفون هاي بالصورة فاينل اسبيريشن شلون التكنيك وهاي السبيشال equipment. It is characterized by a safe, rapid, not expensive, inexpensive and pre-surgical planning is important. Avoid open biopsy. لكن هي مو دائما conclusive especially إذا صارت negative. البوزيتيف يعتمد بس النيجاتيف لا. الاكسجينال بايوبسي more perfect لكن sometimes الاكسجين مبين واضح السكار. إذا أكو sign and symptom of malignancy we have to do excisional biopsy. يعني ندز المريض ultrasound شكل السونارست قال اكو ساين تدل على انه ما مرتاح من الفيتشر اللي جاي يشوفه بالالتراساوند، يعني irregular mass, solid nodule in the thyroid, age not uniform، يعطي hints of malignancy. لسه هو كتب لنا بالريكوست انه تحتاج الى excisional biopsy. persistent lymphadenopathy خاضت علاج وكمل علاج الكورس بيرفكت وكل امورنا بيرفكت، لكن طاقة الليمفادينوباثي معناتها هذا ما يفكر من الانفلاماتوري، قد يكون تيوبركلوسيس قد يكون مالجنس. فالاكسجينال بايوبسي از امبورتنت. اذا الدايجنوستس ريمين ان داوت، يعني احنا سوينا الافراني وعالجنا على ضوءه وطينا تريتمنت بس بقينا في شك انه هذا قد يكون هو مو هذا المين باثولوجي، فلازم قد يكون البرايمري في مكان هذا الاكسجينال بايوبسي ما عرفناه، فنحتاج الى نسوي اكسجينال بايوبسي حتى نتاكد. احيانا تجي الفاينل اسبيريشن مو بالبيرفكت سايت فيعطينا انفلاماتوري ويقعد يعتبر انفلاميشن او something else benign وبعدين تطلع الغرفات تكون malignant. فنخلي بالنا يمكن اكو chance of fault in the examination. لذلك حتى يرتاح الجراح ويوصل الى تشخيص تسوي اكسجينال بايوبسي وشيء. المشكله بالاكسجينال بايوبسي انه المريض يعتقد انه هاي من سوى شال الليمف نود عباله هو انتهى طاب والطبيب شال سوى العمليه وخلصها، هو ما يعرف انه هذا examination. فهذا يسمونه false security of the patient. الواحد الثاني disadvantage مالته انه سكار وراح تبين تبقى اثارها لين راح يصير الانسجن كبير، واحيانا يصير flaring of spread of the tumor to the skin. هذه الخطوات او السكيم تقرون على كيفكم تشوفون. منطينا هو adult patient present with neck mass. Diagnosis suggests and history is suggest the examination إذا congenital anatomy anomaly سوينا لهم contrast. إذا contrast suggested معناتها لازم excisional biopsy. inflammatory condition شفنا inflammatory انطينا تريتمنت مدة أسبوعين أو 4 أسابيع with follow up. إذا اكو improvement تسوي observation to 4 weeks that's all. إذا no improvement معناته نمشي إلى other investigation مثل chest x-ray وهذا purified protein derivative tuberculin test to exclude tuberculosis. إذا إجا positive نحاول على الانتي tuberculosis test treatment. if negative نحتاج إلى follow up بعدين نسوي contrast to exclude malignancy or so on. إذا من البداية إحنا شاكين بأنه نيوبلاستيك هذا يحتاج أيضا إلى خاصة هذا المريض risk factor، فمن البداية نسوي contrast enhancement CT scan و final aspiration biopsy sent to some consultant specialist of oncology. treatment modality either medical or surgical or radiotherapy حسب الديزيز. ناخذ example of each. هو thyroglossal duct اللي هو the commonest congenital neck mass. 50% present below age of 20. 90% in the midline. وتقريبا 9% هي بالليفت و1% بالرايت. usually just inferior to hyoid bone. أكثر شيء below hyoid bone. يكون على شكل painless mass move with swallowing and protrusion of the tongue. لم تصير tender إذا صارت infection. treatment مالته surgically after resolution of infection. عملية اسمها systemic operation. هذا diagnosis in the midline وهذا السيتي سكان مالته. brachial cyst or cleft. هذا congenital pneumonia of the second cleft, brachial cleft, and usually يكون على شكل tract medial to the hypoglossal nerve between internal and external carotid artery. بالbifurcation يفوت. And it's most common as a smooth fluctuant mass underlying the sternocleidomastoid. In the bilateral group, smooth fluctuant mass. شوفها مثل هي cystic دفي. sometimes تصير بيها infection تصير على شكل erythema and tenderness. treatment initially control infection and surgical excision. هذا التيومر وهذا السيست. المشكلة هنا احنا الخطورة بهذا الموضوع excision of such a cyst هو البوزيشن مالته بين البايفوركيشن اوف قريب يفوت يعني مرات تراكت من التونسلر فوسا الى هذا البرينكال سيست. اكو كونكشن هي كلها من السكند برينكال كليفت vascular region. lymphoma is a more common in children and young adults. Up to 80% with Hodgkin lymphoma. Symptoms and signs: larger neck mass. It is rubbery, discreted, matted together, non-tender. Rubbery, non-tender, discreted. شوفها multiple لكن matted together. Sometimes present with fever. It's not exclude lymphoma. ممكن ما نشوف فيفر معناته بس انفكشن. احيانا بالليمفوما نلقى عنده هذا الفيفر، لكن بقيه الفيتشرز مالت الماس هي تخلينا تروح باتجاه الليمفوما. نفحص السبلين والليفر نشوف عندهم هيباتوسبلينوميجالي. يمكن نلقى another lymph nodes, palpable lymph nodes in another part of the neck or axilla, inguinal region, and so on. To examine of the lymphoma, fine needle aspiration is a diagnostic first line of diagnosis. If suggested of lymphoma, have to do open excisional biopsy and full workup by CT scan of the chest, abdomen, head and neck, bone marrow biopsy to reach the confirm of diagnosis. Vascular tumor, lymphangioma and hemangioma. The hemangioma often resolve spontaneously, like the lymphangioma not. CT scan and MRI may help define the extent of the disease. هذا multiple lobulated cyst اللي هو cystic hygroma هو one type of lymphangioma. diffuse multi-loculated or multi-lobuled cystic mass. Also it is a soft cystic rubbery and partially compressible منضغط and may present with pressure effect on the blood vessels, nearby blood vessels, بتشوف engorgement بالماس. CT scan MRI define the extent of the neoplasm. هذا important بالاكسجين. تريتمنت مالتهم اما injection of بي سي بنايل اللي هو بيسبب البي سي بانيل بي سي بانيل احنا ما نعرفه اصلا هذا، لان ما عندنا سواء بالهند جاي يسوي له انجكشن، برا ما عندنا هذا موجود. احنا اكسجين، الاكسجين مالته الا اذا كان اكسسبل تريتمنت له، يعني ليجن نقدر نوصل له شيله كامل نقدر نسوي له. اما other type of oxygen الموس الخطورة بها انه منطقة فاسكولر وما بها شارب ايج diffused، هي هاي تصير سبب في risk of operation not easy accessible. فالاكسجين فقط for easy accessible lesion. هذا البي سي بانايل ماتيريال انجكشن هي عبارة عن يسمونها شلون جروب ايستوكوكل وياها انتي نيوبلاستيك اكتيفيتيز، فانجكشن بالسيست داخله فتكون ديسترويد مثل الانجكشن اوف steroid in some form of hemangioma. Hemangioma often appear bluish and compressible. الليمفانجيوما ما تبين رد، يعني كأنه سكين عادي مع الانجورجمنت لأنه تضغط على البلاد فيسل. Both of them are compressible. لكن هي مو شوف سيست كامل، يعني سيست لكن مو فارغ ب فلويد، يعني هو بلاد. CT scan MRI may help to define the extent of the lesion of the tumor. Treatment depends on the size and site and severity. صغيرة ينترك accessible نشيلها، diffuse وصعبة نحول على اما ننتظر spontaneous resolution within first decade or surgical treatment is reserved for lesion with rapid growth involving vital structures which fail medical therapy. أما عن طريق corticosteroid injection or laser or oral propranolol in infantile type. هذا الصور تشوف السيستيك هايجروما سكين نورمال كلر، بس هي سيستيك وكمبرسبل. الهيمانجيوما تكون الكلر مالتها ايضا بلادي او بلويش او بيربل حسب الفاسكولاريتي. كاروديد باد تيومر، هذا التيومر يكون بالبايفركيشن اوف ذا common carotid artery. Usually it is a tumor of elderly, more than 40, slowly growing, painless, sometimes pulsatile. May be bilateral, mostly unilateral. Movement side to side but not up and down. هاي وحدة من الباثوجنومونيك character of this tumor. أحيانا يسوي symptom of transient cerebral ischemia، يسمونه potato tumor، hard not tender. البالبيشن مالته يمكن يسوي له vasovagal attack لأنه الكيمو ريسبتورز موجودة بالكاروديد بادي تيومر. biopsy is contraindication. Investigation of choice is MRI angiography or MRA. Surgical treatment is based on the patient factors presenting. يحتاج إلى عملية أكثر الأحيان تنترك خطورة العملية والسادة فيه. هنا نقول tuberculosis cervical lymphadenopathy usually in the upper and middle deep cervical, onset gradually, pain أحيانا present or not. Symptoms usually occur and see as constitutional symptoms and unusual in young. إذا abscess مرة cold abscess and تشوف lymph nodes indistinct, firm, matted, fluctuant. Temperature cold abscess وأحيانا discharging abscess. Firm, matted, and fluctuant. Lymphoma, multiple discrete but not matted. شوف هذا الفرق بين mass of the or lymph nodes of the tuberculosis from lymphoma. Lymphoma lobulated, multiple but not matted. Matted together or fluctuate و firm. Indiscrete. ده تكون discrete. Treatment with anti-tuberculosis أحيانا oxygen أحيانا فقط anti-tuberculosis treatment that's all for 6 to 9 months